Polycystic ovarian syndrome is a very common diagnosis of many infertile patients. It's estimated that as many as 10 to 15% of reproductive age women suffer from PCOS. And for patients that are anovulatory or do not have menstrual cycles, it's probably the most common reason that they're unable to conceive. It is a multifactorial process that is a clinical diagnosis. And so if your primary care doctor or your radiologist tells you that you have PCOS simply because of an ultrasound finding, then that may not be true. The ultrasound findings consistent with polycystic ovaries is but one of 3 criteria that you need in order to have the diagnosis. One criteria is to have polycystic appearing ovaries, and that is something that you typically will find on transvaginal ultrasound. Another criteria is to have high androgen levels, either by laboratory tests or clinical evidence of high androgen levels. And then finally, the last criteria is having oligomenorrhea, meaning having menstrual cycles more than 35 days apart. Beyond infertility, there are many other factors that patients with PCOS potentially suffer from. They have a higher incidence of insulin resistance, they have a higher incidence of obesity, though not all patients with PCOS are obese. They have also a higher chance of having elevated triglycerides or cholesterol levels and a bigger waistline. These types of criteria can encompass a syndrome called metabolic X. And patients that have metabolic X have lifelong clinical considerations well beyond just infertility. When we look at patients that have PCOS, we want to help their lifestyle and help these other clinical factors, as well as try to help them conceive with their partners.